Laparoschisis in the newborn. Laparoschisis is a potentially fatal disease. It requires treatment as soon as possible after birth so that the baby's organs can develop. One of the most common birth defects is laparoschisis. However, it is also unknown to the majority of the population. This anomaly occurs when the muscles in the baby's abdominal wall do not form properly during early pregnancy. This creates an opening from which the intestines and other organs of the baby come out. Usually, it is located towards the right side of the navel. Since the intestines are exposed to amniotic fluid, they can become irritated. This is why they can shorten, swell or twist. From birth, the baby will need surgery to put the organs back inside but also to repair the abdominal wall. Despite the surgery, babies who have laparoschisis may have problems feeding, digesting, and absorbing nutrients. Causes and risk factors of laparoschisis. Some cases of laparoschisis are due to genetic changes. In other cases, it can have its origin in the combination of genetic factors and factors related to the mother during the pregnancy. Regarding the risk factors of laparoschisis in newborns are: pregnancy at an early age. Teenage mothers are more likely to have a baby with laparoschisis than older women. Tobacco and alcohol use. Mothers who smoke and drink alcohol are more likely to have a baby with laparoschisis. Diagnosis and treatment. The diagnosis can be made before birth or at birth. During pregnancy, tests for abnormalities are performed. We can thus detect it. In addition, it is observed with an ultrasound. Regarding treatment, laparoschisis is a potentially fatal disease. It requires treatment as soon as possible after birth to allow the baby's organs to develop and be protected in the abdomen. If the defect is slight, surgery is sufficient. On the other hand, if it is a major defect involving the removal of many organs, the repair can be carried out in stages. After the surgery is performed, the baby goes to the intensive care unit for newborns. Risks of surgery. The risks of anesthesia and general surgery are: allergic reactions to drugs, respiratory problems, infection and bleeding. As for the risks of repairing laparoschisis, breathing problems, these can appear if the baby's abdominal space is smaller than normal. The newborn may need a breathing tube and a vacuum for a few days or weeks after surgery. Inflammation of the tissue that covers the abdominal wall. Organ damage. Temporary paralysis of the small intestine. Abdominal wall hernia. Complementary treatments. Besides surgery, babies with laparoschisis also need other treatments such as nutrition for nasogastric tube in the nostril to empty the stomach and keep it that way, IV fluids and nutrients, oxygen, antibiotics to prevent infections, pain relievers. Feeding begins with a nasogastric tube as soon as the baby's bowel function is restored after surgery. Nevertheless, oral feeding will be established gradually. Discharge from the hospital will take place between 15 and 25 days after hospitalization. Prevention of laparoschisis. Prevention involves ensuring proper prenatal care with healthy habits and with the necessary medical appointments to prevent complications. Once the diagnosis has been made, there is a need for specialized management and adequate follow-up. In this case, ultrasound plays a major role. Weekly ultrasound checkups are recommended for 30 weeks of pregnancy. Typically, newborns with laparoschisis are underweight, and between 10 and 20% of them have intestinal malformations. Nevertheless, the degree of bowel distress will largely determine the prognosis of these babies. In recent years, there has been a dramatic increase in survival. This is due to the early detection and application of prenatal follow-up protocols as well as appropriate intensive care.